SCA12 is monogenic. What does that mean?
When we call as monogenic, that means only a single gene is involved. So you don't have to test for multiple genes, right? You have to test for single gene. If this is abnormal, that's fine. The test gene means blood test for that particular patient. Now coming to autosomal dominant, that's a different thing I was telling. So when we call as autosomal dominant, means two of the gene. I'm talking about SCA12 gene. So think that SCA12 gene is there. Two of the gene, one is abnormal, right, and one is normal. Because it's dominant, even one abnormal gene will rule that, and the patient will have symptom. So suppose somebody comes with a blood test that their gene, the two genes for SCA12, one is abnormal, one is normal. Still, the patient has symptoms. Okay. Now what happens? So that's autosomal dominant. What happens when you have a child? So out of the two genes, one is normal. If you give normal gene to the child, and another your wife or who doesn't have SCA12 or even have SCA12 and they give normal gene to the child, so both the genes to the child is normal. That means child won't have and their kids won't have. So when I see autosomal dominant, means out of two gene, one has disease, and once the disease has, it will manifest. It will have tremor, it will have walking difficulty. But during childbirth, it is just matter of dice that if we pass the normal gene, because one gene has to go, one gene will come from male, one from female. We pass the normal gene, that means child won't have. So there's a 50% chance of getting for the child and not 100%.